Minister of Health Honorable Dr. Frank Anthony says Guyana will continue to use the AstraZeneca vaccines as there are no reports of adverse effects. Guyana received its first batch of the COVAX-supplied AstraZeneca vaccine in February, a donation from the government of Barbados. In March, the government of India donated 80,000 doses of the vaccine. Minister Anthony provided an update on the use of the vaccine during Thursday's COVID update.
We were satisfied that when we used it in Guyana, we did not have any cases of blood clotting, and we have been monitoring for these cases. So we are very pleased with the results that we have had with these vaccines so far, and we'll continue to use them.
The minister acknowledged that there have been many reports of adverse effects in some countries, which have suspended the use of the vaccine and conducted investigations. The World Health Organization, through strategic advisory groups of experts on immunization, had reviewed the vaccines.
And they have concluded that the benefits of the vaccine outweigh the risk. We have had a number of other expert entities that have reviewed the vaccine, such as the European Medical Regulatory Authority, and they concluded similarly that the vaccine, the benefits outweigh the risk.
Minister Anthony noted that some countries are reviewing the data, but the choice remains with the individual countries. He is encouraging persons who have already received their first dose of the vaccine to take their second dose. The health minister has said many have already received their first dose of the vaccine and will soon be due for their second dose, and he is encouraging them to do so. Meanwhile, Dr. Anthony said the second dose of the COVID-19 vaccine is important as the first dose only stimulates the immune system to produce antibodies. He explained that after a while, those antibodies lessen, but with the second dose of antibodies, an individual is better protected from contracting a severe form of the disease. In addition, Dr. Anthony says that if a person contracts COVID after taking the first dose of the vaccine, that person must make a full recovery before a second dose is administered.
We have also partnered with all the private hospitals to work with them, and the ministry would be providing the vaccines to these private institutions, and they in turn would administer the vaccine to their patients, to people who want the vaccine, who feel more comfortable going to our private institutions, to these private hospitals. And once they receive their vaccines there, the health staff of those hospitals would take the relevant clinical information that we need, and they would be able to issue the card that we are giving to show that people would have received their first dose.
This partnership, he noted, is working well as the government wants to increase the number of persons visiting the various vaccination sites.